Good morning here in Abu Dhabi, about 2 days before we travel back to Texas, to the United States. Looking forward to that immensely. Busy with patients, getting them ready for the summer because guess what? In Abu Dhabi, the local Emirati patients leave for the summer to go to Europe, United States, wherever they're going to summer away, and the expats go home or they travel as well. So the summer for me is time to go home as well. Wonderful system that. I was thinking about you today, and I was thinking about you in the sense that you are a dentist. What drives you? What makes you do dentistry? What makes you want to be a dentist? Or what made you start wanting to be a dentist? Technical excellence? A career? Making money? Supporting your family? I hope so. Interactions with people. It certainly is full of people. A combination of those things. Yet, does your practice feel free, easy, or does it feel difficult? Does it feel way too hard sometimes, or a lot of the time? You know, here's what I was thinking about. Your business should serve your life, not the other way around. Your business should make it easier for you to have time with your family, to do the things that are precious to you, to spread your life transformational love throughout your world. If there's anything that all business owners agree on, it's that that's why they went into business. Certainly one of the reasons that probably drove you to do it as well. So the magic bullet is in you. You are the magic bullet. You may be thinking, I don't know what to do. Let me just tell you something. The only way to get where you want to get, wherever that is, and we should always want to get further along the path than we are now, is to change. We have to change what we think. We have to change what we are. We have to change what we do. We have to do that to get a different result. Remember that Einstein quote, keep on doing the same thing over and over and expect a different result. That is the definition of insanity, and it certainly doesn't work. We have to get on what Jeff Olson calls the slight edge. We have to do little things better, differently. We have to change here and there. You know, something I was thinking, I love these words, you have to be a passionate hopeful. You have to be a passionate hopeful. You have to use your courage. And it takes passion to do that. It's easy to be fearful for all of us. Life is full of fears. Life is full of things that make us feel fearful. We have to do things that are uncomfortable. We have to tell our staff we're going to do it differently. We have to tell our staff we're going to change our scheduling or change our offerings. We're going to start doing things without insurance. Who knows? Whatever you want to do, just telling your staff that can be difficult because they're entrenched in their own systems that they like and they get fearful. You know, it's interesting because one of the areas that everyone's talking about today and should be is our dependence on insurance. As you know, I've talked about that. As you know, you've thought about that. It's a big one. And it's very scary to think of giving up the money that you are making, even though when you look at it and realize that it's taking as much from you as you are making, but you don't know how to change that. You have to think about procedures that you might want to do that are outside of insurance, because in dental school, we learn to concentrate on infections. We learn to concentrate on decay, restorative. We learn to focus on gingival problems and periodontal infections. We learn to concentrate on oral infections. And now we're saying, okay, what can we do that's outside of insurance? Because insurance focuses on infections. And that is something people need care for. However, what is outside of that? A lot of people are into sleep apnea treatments, and that can be very important to some patients, for sure. A lot of people are looking at TMD, temporomandibular joint dysfunction, occlusal dysfunction, dysfunctional occlusion. Those are areas that are often somewhat outside of insurance, and you can make them completely outside of insurance and do them with technical excellence if they call you, if you like them. Orthodontics. Orthodontics might just be your future. You can do orthodontics completely outside of insurance and have patients love you for what you're doing. Trust me, I do it every day. It's incredible. We have to figure out ways to change our practice. But we already know everything we need to know. There's nothing we don't need to know as far as where we're going. We just have to get brave. We just have to find our courage. And sure, there's learning to be had in any given area, of course. Let's think about the fact that whatever you are doing, the thing that will set your practice apart and your life apart is love. Transformational love. Be a passionate, hopeful, a person who changes and shares love and transforms lives in ways that you can't even imagine now. Continue the path you're already on. Make it better. You can do it. By the way, thank you for all of your positive responses. Keep them coming. We sure do appreciate it. It gives us the energy to create this stuff, to keep on talking about it, to keep on sharing with you. We appreciate your using these things, these videos, and our ideas. We appreciate your kindness, so keep it coming. Thank you, and good day.